In the United States, a single ambulance ride can cost $3,000. In the UK, that same ride costs nothing. In Germany, you can see a specialist the same week. In Canada, you might wait 6 months. Healthcare is the one thing every human needs, and no two countries deliver it the same way. How a country handles healthcare tells you what it believes about human beings, whether health is a right, a privilege, a product, or a shared responsibility. The differences between systems aren't just financial. They shape how long people live, how often they go to the doctor, and whether they go bankrupt getting better. The US spends more on healthcare per person than any other country in the world, roughly $12,000 per person per year. And yet, it has lower life expectancy than most other wealthy nations and ranks poorly on preventable deaths. Around 30 million Americans have no health insurance. Medical debt is the leading cause of personal bankruptcy. The system is largely private and market-driven, producing world-class care for those who can afford it and serious gaps for those who can't. The UK's National Health Service is funded by taxes and free at the point of use. No bills when you visit a doctor or hospital. Every resident is covered automatically. The trade-off is waiting times. Some non-emergency procedures can take months, and the system is under consistent pressure from underfunding. But the fundamental principle is that no one goes bankrupt from getting sick, and no one avoids a doctor because they can't pay. Germany uses a hybrid system, a mix of public and private insurance where everyone is required to be covered, either through employer-based public insurance or private plans. Germans can typically see specialists quickly, have broad coverage, and rarely face the catastrophic medical bills common in the US. The system is considered one of the most effective balances of access, quality, and cost in the world. Canada's system is publicly funded and universally available. No one pays directly for hospital visits or doctor appointments. But the system is strained. Canada has some of the longest wait times for specialist care and elective procedures among wealthy nations. Some Canadians travel to the US for faster access to procedures they'd wait months for at home. Universal coverage and long waits exist simultaneously, a trade-off the system has never fully resolved. Singapore's system is consistently ranked among the best in the world for outcomes relative to cost. It combines mandatory personal health savings accounts, which individuals fund throughout their working lives, government subsidies for lower-income residents, and a mix of public and private providers. Singaporeans have some of the highest life expectancy in the world at relatively low system cost. The model requires personal responsibility for health savings while maintaining a safety net, a different philosophy from both purely public and purely private systems. Every system makes a trade-off between cost and access, between speed and universality, between individual responsibility and collective coverage. There's no system that does everything perfectly. What varies is which trade-off each country decided was acceptable. Comment your country. How does healthcare actually work where you live? And have you ever been shocked by a medical bill or the absence of one?